Good morning, everyone. My name is Hannah Penner. I'm so excited to share a bit about my public health BA practicum experience with the Missing Middle program. Please hold any questions until the end of my presentation. I will be happy to answer them then. To start us off in a good way, I would like to acknowledge with gratitude that I am on unceded Lekwungen land, the Songhees and Esquimalt Nations territories, and that the Wasanich people's relationship with this land I call home continues to this day. I give my thanks as a settler and uninvited guest who lives, works, learns, grows, and exists in community on this land. First off, what is the Missing Middle program? This program falls under the Provincial Health Services Authority umbrella and receives funding through the BC Children's Hospital Foundation. Its aim is to improve care and services for youth ages 16 to 24 with moderate mental health and substance use concerns. These young people experience the so-called missing middle gap in two ways. They fall between child and adult services and also between community-based and intensive or inpatient care. The Missing Middle program is a relatively new program centered around education, outreach, and direct consultation services at hospitals and anywhere else where a young person may be seeking care for mental health and substance use concerns. During my practicum, I was given a lot of freedom to pursue projects that aligned with the Missing Middle mandate and my areas of interest, helping with other small projects along the way. Some of the smaller projects I assisted with included a quick review of the Missing Middle provincial education modules, helping to facilitate portions of 2 youth action and change circle sessions, adding my voice to an assessment of areas of priority in eating disorder transitions from child to adult services, and using my voiceover and acting skills by portraying a young person in a presentation for the BC Children's Hospital Foundation. My primary deliverables were centered around intersectionality and eating disorders, an area I am incredibly passionate about due to my lived experience. First, I gave an hour-long lunch and learn presentation, Diversity, Visibility, and Eating Disorders, to around 60 healthcare practitioners and other attendees. Second, I created a zine for healthcare providers about supporting young people with eating disorders. This was informed by a survey of healthcare providers and by the lunch and learn session questions and discussion. I knew right away that this practicum would align with the public health and social policy values. First, I practiced critical analysis grounded in principles of social justice and equity by focusing on intersectionality for my major deliverables. Second, I demonstrated collaborative action across sectors, professions, and disciplines by working with a fantastic multidisciplinary team. Last but not least, I showed respect for Indigenous rights and knowledges by familiarizing myself with PHSA anti-racist and decolonial policy, ensuring that my work was created responsibly and not speaking for or over Indigenous peoples. In terms of PHSP knowledge areas, the main 2 I continued to develop were social and life course determinants of health and improving health and reducing health inequities in communities. I learned about the challenges of transition-aged youth seeking mental health and substance use care and opportunities for individual and systems-level improvements. Working with the transitions and linking to care team showed me just how important education and knowledge translation are for improving healthcare access, outcomes, and equity. Just like any segment of the population, young people have unique needs when accessing care. Healthcare providers do not always feel comfortable helping young people with mental health and substance use concerns because they may lack the experience, knowledge, or expertise to do so, which is where educational modules, presentations, and informational toolkits, or zines, can make a big difference. Reducing health inequities among young people also means ensuring that all resources are intersectional in nature, which is why I focused on intersectionality and eating disorders, an area where resources are currently limited and difficult to find. By synthesizing information from the Missing Middle research team, I was able to reach an audience of healthcare providers and share key information and resources about eating disorders and diverse youth. Over time, I hope that my zine can help healthcare providers feel more confident delivering care to missing middle youth with eating disorders by providing an easy-to-use, quick reference guide for healthcare providers to address their questions, and by aggregating the main resources for further information. Knowledge translation and sharing is an essential strategy for addressing health inequities and improving healthcare services for young people with mental health and substance use concerns. Now for some key insights from my studies and practicum. I learned to communicate, translate, and stay passionate. I found that interprofessional practice is a constant exercise in communication, and it's important to keep developing these workplace communication skills. In addition, my presentation and public speaking skills came in handy, and I found that they are so important for advocacy work. Knowledge translation came up throughout my studies and was central to my practicum work as well. Education across disciplines is essential, and knowledge translation is critical for change. It's also important to know your audience. Lastly, I know to stay passionate. This practicum taught me that lived experience is increasingly valued in mental health and substance use spaces and other areas of public health practice. Working in areas of passion is the most fulfilling work of all, and my best work is informed by genuine interest and care. It is not a weakness, but a strength to be guided by your heart. My proudest moment was definitely when I had the opportunity to deliver a lunch and learn presentation to around 60 healthcare providers about diversity, visibility, and eating disorders. It was a huge honor to be trusted by the Missing Middle team to be in charge of developing this presentation from the ground up. I was able to cover so much ground in an hour, everything from addressing harmful stereotypes about eating disorders to creating a visual representation of what young people might go through when they don't feel sick enough to receive help, to diving deeper into how experiences like neurodivergence and chronic illness can increase risk for eating disorders, and exploring the Missing Middle experience and key themes from Missing Middle case consults. If you or someone you know is struggling with symptoms of an eating disorder, please take a look at this landing page of resources that I created during my practicum term. You are not alone, you deserve help, and recovery is possible. I would like to give a special thanks to everyone who supported me on this journey, including my practicum supervisor, Bethan Toner, the Missing Middle team, Jill Dolding, Heather Ulmer, Dr. Natalie Franzen, my parents, Aylin and Carrie Penner, who I believe are both in attendance today, and my partner, Harrison Munschitz, for helping me be where I am today. Thank you again. I also want to thank you all for attending, and if you have any questions, please feel free to ask them now.